Welcome to Part 2 of Caravel Autism Health Parent Orientation. During your initial visit, your senior therapist will come to your home to meet your family. The senior therapist will spend time building rapport with your child and conducting a developmental assessment. This helps with selecting appropriate behavior technicians and programming that best fit your child. Treatment goals, questions, and concerns are discussed. A more definitive schedule and designated therapy area will also be discussed. 2 or 3 initial visits may take place depending on your family's insurance. 1 initial visit may take place before treatment is authorized by insurance. Depending on several factors, it could be approximately 3 to 6 months from your initial diagnostic evaluation appointment to the beginning of treatment. This time may be longer in some communities. It is ideal to have a room designated for therapy. Caravel Autism Health understands that this is not always possible and will work with you to identify treatment space in the home. Therapy should ideally be in a room that is comfortable for your child to be in and that has space for playing on the floor. A low traffic area is recommended to reduce the number of distractions and interruptions so your child can keep his or her attention on the lessons being provided. Often, a bedroom, den, or an area of the basement is used for therapy. Your senior therapist will also recommend materials such as a small table and chair or preferred item of your child to belong in the treatment space. If your plans include having therapy take place in a daycare setting, the daycare will need to be informed of Caravel Autism Health's guidelines and agree to therapy occurring on site. There will also need to be an area available where staff can work one-on-one with your child. Your treatment team realizes that we are using your personal space for providing our services. Team members will want to know your basic house rules. Examples of house rules may include where to park, where to enter, whether shoes should be removed upon entering, using water bottles or cups with covers for beverages, and other basic house rules you may have. These will be discussed with your senior therapist who will communicate your house rules to members of your team. If you ever desire to make changes to your house rules, please let your senior therapist know. If you have pets in your home, please let your senior staff know what type of pets you have and how many. This will assist us in finding staff who do not have allergies to animals to work with your child and help to prevent future staff changes. We ask that you are able to provide proof of up-to-date vaccination records for all pets in your home and keep pets away from the therapy area when staff are on site. Any animal bodily fluids must be cleaned up and the area disinfected immediately. Life with a child on the autism spectrum can be difficult. We at Caravel Autism Health understand. To give your child the best possible opportunity to make improvements that have a positive impact on their life and your family situation, you need to participate in your child's treatment. Expectations include the following: attend team meetings if they are scheduled. Attend weekly meetings with your senior therapist, treatment plan reviews, and other meetings as scheduled with clinical leaders. Attend parent training sessions. Participate in goal setting for treatment plans. Maintain the schedule agreed upon by yourself and your therapy team. Present constructive feedback or concerns to your senior therapist. Maintain consistency and follow behavior plans implemented by your senior therapist. Do your best to avoid activities which may not be helpful to your child's therapy. What is a team meeting? A team meeting is an hour-long meeting in which staff addresses progress, programs, training, and behaviors. Not all teams will have meetings. Your senior therapist will inform you if a team meeting is scheduled for your child's team. Parent participation is required. What is a treatment plan? The treatment plan refers to a written document that outlines the progression of therapy. It lays out your child's current functioning level, goals for your child, and a plan of action for the future. Treatment plans are also submitted to insurance companies to obtain authorization for services. As a member of your child's therapy team, it is important that you review your child's treatment plan with your senior therapist. Your child's treatment plan also contains a section regarding family goals. This is not only necessary for successfully making improvement in your child's skills and your family's daily life, but also for obtaining insurance funding to continue your child's treatment. Our clinicians are committed to supporting you to develop and achieve these goals. What is a treatment plan review? It is conducted by the lead BCBA. A treatment plan review is a routine visit to assess the progress of your child, review programming, provide input, and address family concerns. Regardless of your schedule, treatment plan reviews take place during normal business hours. Parent participation is required. What are parent goals? Parent goals and generalization of skills by parents are required by insurance companies for continued funding. Parent goals are an important part of your child's progress. You will develop these goals with your clinical team. As long as there is someone over 18 in the home as a guardian, you are free to do as you please. Many families use this time to catch up on things they cannot do with their child. For example, laundry, cleaning, emailing, yard work, reading a book, etc. During sessions that are scheduled as parent meetings or parent training, which is generally about 1 hour per week or 1 hour every other week, we would ask that you keep the session time free from distractions so that both you and the clinician can devote the energy and time to work on your child's goals. Although you are in your own home, it is important to maintain a certain level of discretion in your activities. Caravel staff are visitors in your home. Your home is also our work environment. Here are a few guidelines to make sure that all goes well. Clean up anything on the floor where staff may be, including spills and pet messes. Human and animal bodily fluids must be cleaned up and the area disinfected immediately. Make sure that access to hallways and rooms where staff need to be are free from clutter. Help staff have a pleasant work area by adjusting the temperature to a reasonable range. Be sure that the work area is in good repair by fixing things that are broken. If you smoke, keep the therapy area smoke-free. Provide proper safety precautions such as working smoke and carbon monoxide detectors, working fire extinguishers, and multiple evacuation options. Staff can't work in an environment where they feel uncomfortable, and if problems become serious, we may have to temporarily discontinue services to give you time to address the problem. Please make therapists feel welcome in your home by being kind and maintaining a suitable work setting. By doing this, you will provide a work environment where staff are able to be motivated to do their best for you and your child. Parents are always welcome to be present in a session. Although it is not required, many families find it beneficial to monitor therapy via a baby monitor or a video camera or nanny cam. Before videotaping, a release and consent form must be completed by each staff member.